Hi, and welcome to the Langley Connection. This is the show where health meets community, brought to you by Langley Health Services. We'll be sharing helpful tips, expert insights, and stories that matter to you and your family. Thank you for listening. We're excited to connect with you. Welcome to the Langley Connection. My name is Brody, and I'm your host, and joining us today for our very first episode, we have our very own CEO, Vicki Wynns. So thank you, Vicki, for joining us.
Thank you, Brody. I'm happy to be here.
Absolutely. So if you want to kind of start and tell us, you started as a nurse and now you are a CEO. So tell us a little bit about your transition of how you became the CEO from a nurse.
It was quite a journey, I can tell you that, and started longer than I'd really like to advertise. But it's been a wonderful experience, and nursing is a wonderful, wonderful umbrella for so many career paths. And I became a nurse a very long time ago. And there was a time when I thought I would only be a bedside nurse. I was very happy at the bedside, but I am a fixer. I like to improve processes and found myself in a variety of roles in our local community hospital where I was really afforded wonderful opportunities, wonderful mentors, and a lot of growth professionally and, of course, personally. So fast forward to February of 2012. I left my favorite job at the hospital as the director of women's services in the Life Center for Women and Pediatrics to join Langley's team. And it's be careful what you pray for. You might just get it. And at that time, I really didn't know much about health centers. I really liked the opportunity and the concept of having nursing responsibilities in other departments outside of nursing. So that's what lured me over. And it was really a roller coaster ride. So I left my hospital on a Friday and joined Langley's team the following Monday. So probably not one of my brightest decisions, but nonetheless, I was excited for the opportunity. And I've been with the company since February the 6th of 2012.
Wow, amazing. So you talked a little bit about that transition from a hospital to an FQHC. What are kind of the differences you would see? Like I say, let's go to private practice and FQHC. What are the differences you would see in that?
Well, health centers are afforded a lot of benefits that private practices don't. And also with that, we get a small amount of funding through the federal government to be safety net providers for families that are uninsured and underinsured. But at the same time, we're heavily regulated to ensure that we're using those funds properly and as they're designed. So our budget's much larger than our federal contribution, but as a health center, we're afforded our malpractice insurance under the Federal Tort Claims Act. We are governed by a voluntary board of directors, and the CEO reports to the board, and everybody else reports loosely to the CEO, obviously not directly. And we're offered also our patients the sliding fee discount program, so they can be seen at a discounted rate, even if they're uninsured. And we help them with that process. So there are many, many benefits of being a health center. We also have an enhanced rate for payment for Medicaid clients and Medicare clients, where most private practices don't want a lot of Medicaid patients because their payment rates are so much lower. So we welcome all payers, of course, uninsured, Medicaid, Medicare, and commercial insurance. So we have to run our organization like a business because no mission, no money, you have no mission to run it. So we run it very much like a private practice where we want to be attractive to all patients and families and treat them like one of our own.
Correct. So one of the things I kind of want to point out is, you talked a little bit about it, but the misconception that Langley is only for uninsured or underinsured, and you touched really great on that. If we accept most major insurances, we see Medicare, we see commercial, and all that kind of stuff. So that's one thing I really want to point out. So let's talk about Langley Health Services and how we got started. So we're in our Sumterville office currently. How did we started in Sumterville, then how did we expand?
Okay. It's really quite the journey. We've been in Sumter County for over 50 years, providing services, primary care to the local community. But back in the 70s, there was a gentleman, a physician out of Lake County, Dr. Thomas Langley, who identified a need with families that were largely migrant, but not entirely, who really had no health care, no access to health care, and they oftentimes traveled following fruits and vegetables when citrus was so big in Florida. And really, that was a spinoff. And there was also a gentleman out of Royal who had been a Sumter County native, relocated to Pickfruit, Mr. Maitland Keeler, who also had a lot of interest in health centers, had just learned about them and shared that vision with local residents of Wildwood, actually. So we became incorporated in December of 1974 and a health center. So we have been in Sumter County for a number of years. You know, it really didn't have any growth until October of 2012, and there was federal funding available prior to that, and the company applied for that funding, received it, and built our first 20,000 square foot multi-purpose building in Silver Spring Shores. And they offer primary care very similar to what we offer here in Sumterville. And there had been no expansion prior to that. And then in 2015, Citrus County became up for what they call a competitive application. And it was a wonderful geographical fit because you have all of Sumter County, you have Southeast Marion County, and all of Citrus County. So after a lot of debate and analysis, they had a very high uninsured rate. So our CEO at the time, Thomas Chase, had some hesitancy about applying. But after we talked about it, we decided, and with the support of the board, we applied and opened our first office in Citrus County in June of 2016. So we have 4 clinical locations in Citrus County currently, the location in Silver Spring Shores in Ocala, and of course our location here in Sumterville, where we provide primary care services, pediatrics, podiatry is a specialty service that we provide, pediatric and adult dentistry, and a pretty robust behavioral health footprint now.
Absolutely. And one of the ones is the Behavioral Health Hub in Inverness that was newly transitioned from our dental office. So I think it's doing really, really well. And I think it's, you know, huge for that community that we're able to offer. We listen to our community members to try to help serve those. And I think it's going to be huge and beneficial for us. So you talked a little bit about the services. One of the big ones is a pharmacy that we have. We do have it at our Sumterville office, but we are looking at opening it in one of our other offices. You want to expand a little bit on that?
Absolutely. The pharmacy is wonderful for our patients and for the organization as a whole. We receive pharmacy benefits through the 340B drug program, and it really affords our patients discounted medication. The cost, it keeps them much more compliant with the administration of their medications because it makes it easier for them to afford. It's good for the company. And you're right, the only in-house pharmacy that we have is in Sumterville. So we are doing some analysis, and we plan to open our second pharmacy in our Ocala facility and hope to get that launched this calendar year with a little luck and timing in 2026. That'll be good for those patients and that community as well.
Absolutely. So I think it's going to be huge for those patients, like you said. The Sumterville does really well, and I know we have our walk-in clinic in Sumterville, and they really benefit from that, having that pharmacy right down the building for them. So I think that's huge. So, you know, we talked about a little bit of a community health center and the community impact that we do. So we do provide a few community events. So can you expand on those 3 huge community events we host?
Huge would be the accurate description. So certainly, we have a huge family event in Sumterville called the Laura Vickers Christmas Party for Children. Laura was a team member over 20 years ago. Her mother still works with us in the Ocala location, and Laura was killed by a drunk driver. So in order to keep her memory alive, her family, her extended family and friends, and the organization always supports Laura's dream of giving children that might not have a good Christmas a wonderful holiday season. So we host that here in Sumterville. We have wonderful collaborative community partners where we provide bounce houses, hot dogs, food, lots of drinks. The sheriff's office is always wonderful with bringing out their SWAT team, fire and rescue. So we have a lot of community partners who focus on childhood literacy, enjoying the day, and we're able to provide over 90 bicycles to children. And we did it this past December in a drizzle that lasted all day long, as you know.
Yes.
So it's a wonderful opportunity for our team members to contribute and support Judy and Laura and their families.
Oh, absolutely.
And then we also do in Sumter County, we do a huge back to school bash with many of our collaborative partners as well, where we offer free haircuts, backpacks, school supplies, hot dogs, the old famous bounce houses again. And we've done that for a number of years in Sumter County. And we've been in Citrus County at the Armory now for the last 3 years doing a similar event in Citrus County to support those residents as well.
Absolutely. I think, as one that volunteers also for those events, it's huge and it's rewarding to help the community.
Absolutely.
And the biggest thing for us is, we're able to host it, but it takes all the community partners to bring it together.
We're very blessed,
successful.
very blessed there.
Absolutely. So I think that's huge. I really enjoy those. But our newest venture, we're being a little bit innovative. We're trying something different here, and that's the Langley Connection. So can you expand a little bit about what the Langley Connection is?
I can. It's interesting, Brody. I think it's exciting for me to be able to lead our organization into the next chapter. It's been just under a year that I've been in the role of this chief executive officer. I couldn't be any more pleased with the progress we've made to date. And with our wonderful marketing team and your willingness to be our host, we have decided to get creative, innovative, and offer a platform to where we can continue to promote Langley Health Services and all the wonderful things that our team does to impact each other and the communities that we serve. So to me, it's just getting outside of your comfort zone, which I think would be a fair statement, and finding a way to make sure that we really focus on the wonderful things that we do. We are a diamond in the rough. There are so many people who don't realize the wonderful care that you can receive in a health center. And when you see one health center, you've seen one health center. But I really want to promote all the wonderful things that we do and the team that I have the privilege of leading and getting to work day by day with.
Absolutely. I think we have a bright future for it. I'm excited for the guests that we have on here. I think we're going to have some really good guests to kind of share some information too, and whether it's a little bit about Langley Health Services, but also about our community partners and the services they offer as well. So I'm really excited for it. I'm really excited for our future with this, and I can't wait.
I would totally agree, and I appreciate your time and leadership and launching the podcast. So
Absolutely.
Thank you so much.
No problem. Thank you for joining us again for our very first episode.
It's my pleasure, Brody.
So stay tuned for our next episodes, and we'll see you next time.